Casimira from Maulana Malik Ibrahim, and the title of our paper is Youth Health Community Movement Through Social Media and Directly in Anticipation of the Possibility of Pandemic Cases in the Future. Okay, as we know, that for several thousand years, it was reported by World Health Organizations, there have been many cases of epidemics, including TB epidemics, meningitis epidemics, HIV epidemics, and even the pandemics as examples of Spanish flu that killed millions of people at that time. And also, the latest pandemic in the world is COVID-19. As we can see on this, that it takes time of durations of infections. So the optimum of immunity, so that the body can resist the incoming pathogens. And also the main things is we have to have the good conditions of immunity so we can survive, and the starting point is the willing of the people to have health lifestyle that can start from a community. A community is a group in which every members are united by the visions and missions and also the purpose. Thank you.
Here I am Berliana Nur Khatijah. I will continue my friend explanation, and my explanation is about experimental methods. Okay, our method is observation method. What is that? It is about the selected method for with direct observation. And the method is data collection by observing directly in the field. Observing, not only viewing, but also recording, counting, measuring, and recording existing events. Observation can be classified as a technique of collecting data if it has the following criteria. Number 1, used for research and has been systematically planned. Number 2, must relate to planned research objective. Number 3, it is systematically recorded and associated with a common proportion and is not displayed as an eye-catching set. Can be examined and control validity and its reliability for the fact. Okay, according to the Gardner, the sense of observation is given the following limitation: deliberate and systematic study of social phenomena and physical symptoms by way of observation and recording. Furthermore, the observation objectives are understand the characteristics and breadth of significance of interrelation of the element of human behavior and the complex social phenomena in certain cultural patterns. Okay, so that what is about the result that we can get? The result is based on like this data. This is the data of our result. Based on the data can be seen that enthusiasm of social media users, in particular Instagram, is good enough in following a community. Community number 1 is a mental health community. They have several agendas such as webinars as well as free consultation on their Instagram feed showing image slides that contain message in terms of mental health. This has a good impact, so the community has a follower of 1,850. Then the number 2 community is a community of health ambassadors can invite 2,973 followers. They have programs that rarely come to the community, and also online talk show for community. And then for the number 3 community is about bicycling community. They perpetuate its activity and also held events that can be participated by all cyclists. They manage to influence 110 followers. And the number 4 is community of the nurse check. This is a community about a check up and also help counseling and managed to invite 195. The term new media has been in use since 1960, include a set of applied communication technologies that growing and differs. This technology differing to use of the electronic device communication media and usually strengthened after the advent of computers and the internet. The use of new media by the community as a spreading tool, information and media used to facilitate public certainly not a stranger anymore. Various advantage on by the media makes it easy to gather new members and provide information relating to the community activities. To the broad audience, it utilizing advantage of new media community pioneered by the younger generation is capable of the media to make change movement. Astuti in her book titled Remaja Digital mentions that new media with characteristic of interaction can be so positive. So that's all.
Hello, my name is Nuradila Usman and I'm from Maulana Malik Ibrahim Malang. I will tell you the conclusion of our paper that we met. So community is a good place to channel and provide health information. The more people who participate will be easier to bring the future towards the better. The health community will be very good if doing activities in the network and outside the network. Providing information with interesting forms will dance the attention of readers, and activities directly also need to be done to reach a healthy future together, so that it is inevitable from serious health problems in the future. Based on data, it is also apparent that the online health community is effective in fighting people and is effective for sharing health information. So that's all from our presentation. Thank you for watching and Assalamualaikum warahmatullahi wabarakatuh.